A very good day, my dear postgraduate students, especially the exam going. What are we seeing on the screen? Non-accidental injury in children. Helen Head Whitwer. Recent advances 19 and it is for postgraduates. Also, I have included an insert at the left corner. Try to guess what it is. Many a topic is quite vague, and the purpose of my presentation is to make you people attend all the questions and come out with reasonable marks in all vagaries. Do we know the disciplines involved, the interlinked subjects, the site, the cause, the trauma, the manifestation, and the diagnosis? I leave it to you. No question is so difficult to answer as one in which the answer is obvious. George Bernard Shaw. A superb saying fits the purpose. Definitions are definitions. Non-accidental injury is that a child is treated in a way that is unacceptable in a given culture at a given time. So, very important from the legal point of view. It is a global problem. The percentage is given over here, 4% in UK. Fatal cases are more, less than 5 years of age. And the importance is to distinguish it from SITS and also what are the major areas that are being involved. I would like you people to subscribe, not for my benefit, but for your final exam, because that gives you an index of the topics that are covered and what you need is to be chosen. Classification again, it can be physical, sexual, emotional, or neglected. These are the major subheadings that the author deals the topic under. And coming to the physical, you find that the head and the abdominal regions are more commonly involved than others. Then the skeletal and the soft tissue, burns or scars in the skin and the subcutaneous tissue. A battered child is a term that we should know to define. Please do understand. So, by all these terminologies, I find that it is more of a forensic pathology rather than our medical pathology. And also, the disciplines and the persons, the entire list is given over here. I wouldn't say entire, it is still not complete. There is an insert that is possible. The classification being continued. Now, what are the common sites and the non-common sites? So this is important because at a postmortem, when we are to examine and to give an opinion, there should be some amount of common sense and possibilities that are there, under which the common sites are the forehead, the crown, fractures will be possible, elbows, knuckles, knees, and shins. Probably these are all the orthopedic region. So for accidental injury, these are the things. But for non-accidental injury, nobody will directly go and have the injuries in the eyes, ears, cheek, mouth, shoulder, and all the other sides, buttocks, genitals, etc. So this has to be borne in mind. And you find that strangely, sexual abuse is not so very common in this non-accidental injury. However, the genital examination is required. Malnutrition again is unlikely. However, there can be a cachexia in a child that is suffering from mental retardation or any congenital deformity as a cystic fibrosis, or there is adrenal hyperplasia. Obviously, a correlation between the hormones and the other things will be mandatory. And there is also some forced inappropriate illness. This I shall be coming to later on, given by the caretaker. So not only neglected, but then they force upon some kind of an injury to the victim. At the post-mortem examination, the forensic pathologist, along with the pediatric, neurological, and ocular pathology, all these things are to be studied. And there are some terms such as the cord death. I'll be dealing with it. SITS, both are more or less same, and it is becoming increasingly uncommon. So this cannot be given as a cause of death. It can be viewed with suspicion. Neurological again. And also, as I told you, any prematurity in the form of low birth weight and recurrent respiratory infection should be recorded. And before proceeding with the post-mortem, the clothing, the photography, the picture of bruising, the skeletal external examination, etc. are mandatory. Bacteriological sampling, particularly when there is some kind of an aspiration pneumonia. Toxicology, the contents might be essential, particularly with multiple toxins. DNA sampling finally. So this particular list, I would like you students to kindly have it in mind. As I told you, you should know where exactly you are going. The old and the new. Always there can be the fractures. So one such thing will be important will be the timing of the fracture. It can be an old one or a new one. Old one, you find it becomes more rounded. There is some kind of a remodeling that has been possible, whereas a new one will be having sharp serrated ends. Thanks to this reference for this beautiful picture. The shaken baby syndrome, something that even I was not very well aware of, something that we can mention. Obviously, in a condition of violence, you find that there can be a baby that is being shown in sheer frustration, anger, and so on. But see what are all the things that can happen. There can be a retinal hemorrhage, there can be an edema of the brain, there can be a subdural hematoma, courtesy Washington Post. And this indicates the type of hemorrhage and hematoma. Normally in a trauma, it will be unilateral and unifocal, but here it becomes bilateral, bifocal, and there can be a tear also that is caused. As of now, mnemonic. I would like you people to kindly follow this, go through this. So these are the areas, etc. And for a child less than 4 months, it is unlikely that there can be a bruising, that is flying from area to area. So this is a code. Kids that don't bruise rarely bruise. And do you know your exam questions incidentally? This is not related to the topic. Between accident and abuse, there is a pattern. This is usually for the plastic surgeon and the forensic specialist. So they'll have to note the site, the number, and the pattern. In one, I find that it is more likely to be a traumatic one, whereas another one can be accidental. So bilateral, it is likely to be more of a traumatic one. And so also over here. So these are the areas of abuse. Look at this over here, bilateral, and the regions that are being affected. External examination, these are the things that has to be borne in mind. One is bruising. The sites are given, particularly the buttocks, faces, the cheek and the mouth, the fingertips, and bruising and mobility go together. So this is important. External bruising, sometimes it can be absent in the abdomen and the head. And there is another entity called the battered child, wherein the skin and the subcutaneous, skull and the spine, thoracoabdominal and the skeleton will have to be examined. Second one is burns and scars. So accidental scars are actually irregular, whereas inflicted wounds will be having a definite pattern. And cigarette soldering or iron soldering, you people will be knowing. This is a bite mark that you people see. I am finding 2 semilunar marks that are there along with the dentition. Obviously, the forensic dentist is required in this region. And in this case, it is thought to be something like a multiple traumatic one, but it happens to be a DAC, meaning that we should also know the other differentials which are possible. Thanks to ResearchGate for this picture. The lips and mouth, frenulum. Particularly, frenulum is an area that connects the rest of the mucosa to the lips. If there is going to be a trauma at this particular region, then it means it is an inflicted wound and not an accidental one. Eyes, of course, the petechial hemorrhage. This can be due to any pressure on the neck and chest leading to hypoxia. And coming to the central nervous system again, there are two things. One is the skull and the other is the parenchyma. Skull fracture will be having more of an impact injury as this. So you find that this is a shaking child over here. There can be multiple complex and branching injuries. What I call a comminuted fracture or a complicated fracture when there is injury to the brain parenchyma. And also it is occipital, it can be bilateral, and it is quite depressed. That was what the original scan picture in the slide showed us. And this is all we will have to have in mind: the joints, the organs, and the brain. And in neuropathology, you find that there is a wonderful list that is given over here. And as a pathologist, there can be an older injury and a newer injury, deposit of some material such as amyloid. And hemorrhage can be in multiple sites, as shown in this particular one: subarachnoid, subdural, epidural, etc. So the key words that you people will have to remember will be the hematoma, the amyloid, the hemorrhage, the brain, and the spine. And always we'll have to rule out the other causes for hemorrhage. The eyes and the ocular hemorrhage, it is difficult to relate to the etiology. It is bilateral in a case of non-accidental injury. And in this picture, I am finding that there is a laceration of the eye and there is a prolapse of the iris. Grossly, there can also be an optic nerve injury, and histologically, there can be hemorrhage in all the layers which can be identified. And these are some regions which he has mentioned. There can be other causes which can be leading to hemorrhage. This one we are all quite familiar with: sickle cell anemia, leading to an obstruction. Coats disease is another one. It is a congenital disorder wherein there is a weakness in the vasculature. And here again, I'll be able to see this pattern of hemorrhage in the eye. The other causes are given over here. Thoracoabdominal injuries. You find that they are second most common, and there can be rupture of the parenchyma and the intestine, intra-abdominal bleeding, shock and peritonitis, sepsis. So these are all the things that are there. And the various causes have been mentioned. What can be the predisposing conditions that are there? So you find that it can be because of these. There can be a separation, a lack of follow-up, imprisonment of the parents also, death of the victim, and so many other things are there. So I would like you people, there's a list and the incidents that is probable. The skeletal trauma. Radiology is a must before the post-mortem, and these are the regions that should be examined. I told you earlier the picture of the ribs, wherein I find that there are multiple fractures. In a trauma, it will be unilateral and unifocal, whereas it can be bilateral and multiple in a case of intended trauma. And this is one. I find that there is a bilateral subdural hematoma that is there, predominantly located in the basal frontoparietal convexity. Thanks to Radiopedia for these pictures. Essentially, negative postmortem. You find that sometimes we will not be able to diagnose certain things. So you find that sudden infant death syndrome, sometimes it can be mistaken for it, and it is not that common, 2 per 1,000 live births. Hence, there has to be a perfect history that is needed. Advised on a back to sleep. When an infant or a child sleeps by the side, there is a greater chance of a smothering by the mother itself. And avoiding a common cot. These are all certain things that have been mentioned. But however, any other thing can be having the siderophagus in the lung, and the autoimmune disorders such as the Goodpasture syndrome will have to be ruled out. So also the airway obstruction. And there is another new terminology called as MSBP, which we shall be seeing. So it is called as Munchausen syndrome by proxy. So it is a factitious disorder or fabricated disorder that has been induced by the carers or the caretakers. So this is one. And what are the leading points in favor of it? You find that there will be repeated symptoms and signs, repeated apneic attacks, poisoning by a variety of substances, foreign material in the airway, postmortem abnormalities are minimal, and frank bleeding from the mouth and nose, which is again uncommon at this age. So a full postmortem evaluation will be needed and difficult to make up. So this syndrome by itself is a topic for discussion. And this is what is happening. Normally you find that there can be some between the death and the abnormal, there can be some amount of overlap. Whereas in a case of abuse, you find this element comes in. Munchausen syndrome by proxy. That is over here. So this area of overlap has to be considered. This is a very important slide. In fact, an algorithm in which the diagnosis of R.A.T is given over here. The physical examination, the skeletal survey, the head CT scan, and the laboratory findings, such as the various clotting factors for the DAC, etc. And any region of suspicion, what are all the things to be done? This is a very good one. I would like you people to kindly go through this. And during resuscitation also, there can be injuries, and these will have to be mistaken. These can be before or after hospitalization, and see what is happening. Obviously, with this amount of force, there can be fracture of the ribs, but this should be differentiated from the non-accidental injuries. Before anything else, preparation is the key to success. Alexander Graham Bell. And that is exactly what I am trying, and I would like you people to follow. Thank you.